So all children in the state of Texas are now mandated to have newborn hearing screen. But there are some forms of hearing loss that there's a 10% false negative and false positive on newborn screening. That means some of these kids are going to be missed. It is now even being recommended that all babies have a repeat hearing test done at their pediatrician's office by about 10 months of age. And that is because some hearing losses are missed on newborn screening, or some could be progressive and not show up until a little later. So newborn hearing screening is very important. A repeat hearing test is recommended at about 10 months of age, but this is the most important thing. Any parental concern about hearing loss requires very detailed professional testing, because we don't want to miss something. If a child has hearing loss, the earlier it's detected, the better. So if any parent has a concern that their child's not really responding to sound the way they should, that needs to be respected and the child get professional testing.